All right, we have Gary here. Gary has some issues with his low back from an L&I injury. And Gary, go ahead and lay down for me. Gary had actually hurt the disc in the lower back, so I'm going to share with you today how chiropractors work with disc and low back injuries that have been going on either for a while or from even an acute injury. So, okay. All right. First, I'm going to check the leg length on Gary, and the leg length, what I'm looking at the bottom here is to see how short the leg is. That creates an imbalance in the spine, that creates stress throughout the joints in the body. Go ahead, Gary, I want you to go ahead, raise your right leg without bending the knees. So next, we're checking the sacrum, back down, try the other one. Back down. They're about the same or very similar heights, so I don't think it's as much as sacrum in there, but I'm going to still test it by pressure testing it. Go ahead and raise your right leg for me. Back down. Other one. Back down. That actually looked a little bit worse when we did that. So then we're going to move, checking the pelvic area, and I'm going to press what we call pressure test, or put the area into alignment. This one here. Go back and check both legs even. Go ahead and raise your left leg for me. Back down. Other one. Back down. Okay. All right, Gary, you're going to feel the table drop underneath you. I'll release the middle section. Some chiropractors use a table that drops underneath. That helps the area adjust easier when the patient has a different body type or they don't like a certain technique. You can use the drop piece, and that creates what we call a recoiling action in there that allows that joint to actually move easier. So I'm going to just add a little bit of pressure here. Doing okay, Gary? Mm-hmm. So let's go ahead and put your right hand on your lower back for me. Right leg went a little bit shorter, about 3/4 of an inch. In position 3, goes a little bit shorter there. Hand down. So we're right at L5. Switch hands. Right leg short, goes longer in position 3. 2 and 3, hand down. And we have L4 right there. Pretty tender in that area.
Oh, yeah.
And sometimes when I'm working with the patient, I end up like intermixing some of the techniques with them, depending on their needs. Some of that is experience that a chiropractor has, and you have to listen to your patients when they have certain things going on. Not everything's always clear cut with it, but you try to get them relief and out of pain as quickly as possible when they come in. All right, I'm not going to move you around very much, but I'm going to begin the traction. This is a specialized table called a flexion distraction table. It uses a tractioning motion that ends up flexing the spine to open up some of the areas of joints, hydrates that area, and I have it on a fairly low setting for him. You doing okay?
Yeah.
Alright, by using the massager helps that area relax a little bit before I do the hand type of adjusting into his lower back. He responds really well with being placed on the side. It does a nice, even, tight stretch back there. How's the traction on you? Is that too deep, or
No, it's good.
could you go a little higher?
It's good.
Now Now the disc that he has is more mild in nature of herniation, but it's in a couple areas, so it's under a lot of stress in there. When that disc is out of position, so to speak, or the vertebrae are out of alignment and the disc is being squeezed upon, that also puts pressure on the nerves, and that decreases your ability to function or move. So chiropractors end up adjusting and doing other different types of techniques or modalities to help assist with that, like I'm doing, where I use some massaging or what we call joint mobilization, or even attraction to the area. Okay, so we're going to bring it side to side. You doing okay?
Yep.
Is that too much?
No, you're all right.
A lot of times when we do this kind of work, you have to check in with the patients, because even though you're seeing one thing and feeling another, they're also feeling something else going on in there. So it's good to check in with them with pressure. Okay, we'll bring it back to center. Bring it down. All right, Gary, go ahead, lay on your left side for me, please.
All right.
We'll bring the middle section in. Then the top leg right here. There we go. Good. And go face down. Gary's a really tall guy, and that plays a part on the stress on the lower back as well. So go ahead and raise that left leg for me. Much easier, much better.
Yeah.
And the other one. Back down. And a lot of times you'll hear the patient do that when they're finally getting some relief back there into the lower back. Let's have you lay on your right side. We're going to adjust the upper part of the lumbar vertebrae. You saw it even on camera how much easier it was for him to raise his legs up. So that plays a big part in how the patients feel. That's one way we can test it. Good. Face down. We'll do the test again. Can you raise that left leg for me, sir? Back down. Other one. Back down. What happens is when you get the alignment back into the spine, no matter how your chiropractor adjusts, the body functions better. So simply put, that it's almost like aligning a car. When you align the car and rotate the tires, the vehicle moves better. It's the same here. And over time, when you get adjusted and get that pain, or get the person out of pain, it ends up allowing the person to function better, move better, and be healthier. So I'm your local Lacey, Olympia chiropractor, Dr. David Warwick. Thank you for watching. And if you know of anyone that has disc pain or low back issues of any kind, be sure to get them to your local chiropractor. Thank you.